Our phase 2 trial is looking at a subset of cancer patients that have a very, very high incidence of oral mucositis. And so we have selected specifically those patients who have head and neck cancer, actually in the oral cavity, who are receiving radiation at reasonably high doses, between 60 and 72 gray, so fairly large fractionated doses, and are also receiving chemotherapy. Because we want to follow these patients for a year, we've excluded those patients that have a very poor prognosis. And because we're trying to determine how many of these patients will get oral mucositis, they can't have oral mucositis when they come into the trial. So the way we've designed this is that when patients are diagnosed and are about to begin their chemoradiation therapy, we start our therapy at the same time, so that we're not treating oral mucositis, we are trying to prevent it. So that most of these patients will get a 7-week course of radiation 5 days a week, and then usually a chemotherapeutic agent called cisplatin, either once a week or once every 3 weeks. We give our drug twice a week during that 7-week period where they're being treated, and then we assess them again twice a week for whether or not they're developing oral mucositis. This is a trial that we're participating with about 25 institutions in the US, and we hope to have somewhere between 75 and 100 patients depending on the safety profile that comes out of this. We've started out, because this is the first time we've given to cancer patients, a very low dose. We're going to middle dose, then high dose to prove that it's safe. Once we have that data, then we will go into the main part of the study where we're going to look at a placebo, low dose and high dose, and try to determine what the best dose is going to be. For many drugs, you think of higher dose being better. For this sort of immunomodulator, however, it may be the low dose is actually the best.